Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's topic of ENT is the foreign bodies of food passage. This topic of foreign bodies of the food passage we will cover in 5 different sections. In the first section we will talk about the ingested foreign body and the presence of those ingested foreign body in the tonsil, base of the tongue or vallecula, and then posterior pharyngeal wall and pyriform fossa, and what are the different types of ingested foreign bodies that get impacted in these different areas or sites. Then in the second section, we will talk about the site of lodgement and how they present. So if it lodged in the tonsil or posterior pharyngeal wall, what are the clinical features that the patient will have and how the patient will present with these foreign bodies. So we will talk about the clinical features and the signs of the lodgement of the foreign body in different sites. Then in the third section, we will talk about the some investigative methods for the use for the investigation of foreign body and also how we can manage them. In the investigations, common investigative tests or investigations are the X-rays are very common, and then we can do the examination. Endoscopy can be used, like cervical and transthoracic oesophagotomy can be used as a management step for the removal of foreign body, and also endoscopic removal. So these are endoscopy and oesophagotomy are the management procedures we will talk in the third section, and also we will talk about the different X-rays and different investigative tests for the investigation. Then in the fourth section we will talk about the disc batteries if they are ingested or they are locked in the foreign food passage. Then what are the tests, how we can diagnose it. So X-ray examination is important for the disc batteries. Then we can also talk about some cavities in esophageal foreign body and complications of esophageal foreign bodies. Then in the fifth section we will talk about the complication of the impacted foreign body or ingested foreign body, which is the dysphagia, which is difficulty in swallowing. And what are the causes of dysphagia, how we can investigate dysphagia, what's the clinical examination and radiography for dysphagia, and also manometric and pH studies. So all that we will discuss in our today's topic, foreign bodies of food passage, in which we will talk mainly about the different types of the foreign bodies that can be ingested. A site of lodgement of the foreign body is important, whether it's tonsil, posterior pharyngeal wall, base of the tongue, vallecula, all that, and how the patient with the ingested foreign body will present, what are the clinical features, what are the signs, and also some investigations performed in which X-ray is very common. X-ray can easily tell the foreign body which is present in different sites. And then we will talk about the dysphagia, which is the condition of difficulty in swallowing caused by the presence of foreign body in the food passage. So keep watching sqadia.com to learn about this topic.